What comes to mind when you think of the greatest nurses who ever lived? If you're like me, the name Florence Nightingale will pop into your head. However, did you know that there was a black nurse who rivaled her in terms of impact and accomplishments? And yet we barely know anything about her today. The name of this great nurse is Mary Seacole, a Jamaican-born British nurse who was a pioneer of black nursing and one of the most successful independent black female entrepreneurs of her time. She saved countless lives during the Crimean War and was awarded the Royal Red Cross for her efforts. So who was Mary Seacole? Let's find out in today's episode of Meet the Great Black Nurses. Mary Jane Seacole was born on May 1805 in Kingston, Jamaica. Mother Elizabeth was a Scottish immigrant from Edinburgh who worked as a seamstress, while her father, Thomas, was a carpenter of African descent. The family later moved to the capital city of Spanish Town, where Mary grew up and attended school. Even as a child, Mary exhibited traits of independence and enterprise. At age 10, she started selling ginger beer to support her family after her father lost his job. But Mary wasn't just any ordinary girl. She had big dreams and wanted more for herself than what her society could offer. She developed a passion for reading and taught herself many subjects. This desire for knowledge and thirst for adventure led her to work as a domestic servant for several wealthy families across the Caribbean. Through these jobs, she saved money, which she used to further her education. In 1826, at the age of 21, Mary traveled to London with the savings she had made. There she enrolled at the London Missionary Society Medical School, which was established to train female missionaries. It was here that she met the renowned physician, Dr. James Mangles, who became a close friend and mentor to her. He encouraged her interest in medicine and helped shape her into the capable woman she became. While at the medical school, Mary trained under an African-American female doctor named Dr. Charlotte Murchison. She learned how to cure various ailments and also received training in midwifery. After graduating, Mary returned to Jamaica and started working as a midwife. For a while, it seemed as though Mary would follow the path laid out for her by society, but her ambition knew no bounds. After some time, she returned to London, where she got married to a man named Edwin Bailey in 1830. Unfortunately, her marriage didn't last long as Edwin passed away in 1844. Following her husband's death, Mary returned to Jamaica, only to be struck by yellow fever, an infectious disease spread by mosquitoes. Mary survived the illness, but it left her with hearing difficulties. Undeterred, she set her sights on new opportunities and moved to Panama in 1849. There she purchased a small hotel and boarding house called the Sea View House near the French and British embassies. The business was going well, and the hotel was becoming quite popular. That was until cholera broke out and Mary had to close her doors to guests as the disease swept through Panama. With the hotel closed, she decided to return to London. But Mary's entrepreneurial streak soon kicked in, and she came up with another plan. She used the skills she had learned as a midwife to start delivering babies at home. As her reputation grew, so did her clientele, and soon she was raking in quite a fortune. In fact, she was making enough money to send for her son from Jamaica. However, Mary wasn't content with merely delivering babies. She wanted to do more. When news broke out of the appalling conditions at military hospitals in the Crimea, she felt compelled to do something. The Crimean War was a brutal conflict that pitted Russia against an alliance of France, Britain, and the Ottoman Empire. The war was marked by immense suffering, and the conditions in military hospitals were dire. Soldiers were dying not only from their wounds, but also from diseases caused by unsanitary conditions. Mary was outraged by what she was hearing and seeing. She wrote letters to the British government offering her services as a nurse, but they repeatedly rejected her. Not deterred, she refused to sit idly by while soldiers suffered and died. Instead, she took matters into her own hands. With her life savings, she purchased a steamboat and sailed to the Crimea, despite not being enlisted or commissioned by the military. Upon arriving in Scutari, she opened a hotel near the British military barracks and began providing food, lodging, and laundry services to the soldiers. In addition, she tended to the sick and wounded soldiers, often risking her own life in the process. Soon, word got around about the Good Samaritan running the hotel, and soldiers flocked to her establishment. Quickly became known as the British Hotel. Mary's compassion and dedication to the soldiers caught the attention of the local military commander, who granted her permission to visit the nearby military hospital. Here, She continued her work of providing food and other necessities to the soldiers. She even hired additional staff to help her with the workload. Despite the challenging conditions, Mary's efforts made a significant impact. Her dedication to the soldiers did not go unnoticed, and in 1854, she was awarded the Royal Red Cross for her contributions. This was a prestigious honor bestowed upon individuals who had displayed exceptional bravery and service in the military. The award was especially significant considering that Mary was not a member of the British military. She had been recognized for her outstanding contributions in a field where women were typically not allowed. Her humanitarian work in the Crimea brought her international acclaim and recognition. Upon her return to England, she was greeted as a hero and became a prominent figure in social and political circles. People from all walks of life, including Queen Victoria, praised her for her bravery and selflessness. Mary's story didn't end there, though. After returning to England, she continued her work as a nurse and health advocate. She established the London Nursing Association, an organization dedicated to providing quality nursing care and training. She also wrote several books sharing her experiences and insights on nursing and public health. One of her most notable works was Wonderful Adventures and Mishaps of a Nurse, published in 1857. In this book, she recounted her experiences as a nurse during the Crimean War, providing a first-hand account of the challenges and triumphs she witnessed. She described the appalling conditions in the military hospitals, the tireless efforts of the nursing staff, and the resilience of the soldiers in the face of adversity. Her vivid writing brought the realities of war nursing to life, offering readers a glimpse into a world that was largely unknown to them. Through her book, Mary not only shared her own experiences, but also shed light on the broader issues of healthcare and sanitation. She criticized the lack of proper medical facilities and the inadequate treatment of soldiers, calling for reforms to improve the quality of care. Her advocacy played a part in raising public awareness and prompting changes that would impact military nursing and public health policy. Mary's impact extended beyond the pages of her book. She used her platform to speak out against social injustice and racial discrimination. As a Black woman who had faced prejudice and stereotypes throughout her life, she was passionate about advocating for equal rights and opportunities for all. She challenged the prevailing notions of the time, which often limited the roles and contributions of women and people of color. Mary fearlessly confronted racism and sexism, demanding that they be acknowledged and addressed. She believed that everyone, regardless of their background or circumstances, deserved to be treated with dignity and respect. By speaking out against discrimination, she paved the way for future generations of Black nurses and other minorities to pursue their dreams without being held back by societal constraints. She continued working as a nurse and health advocate until her death in 1881. Throughout her life, Mary Seacole demonstrated remarkable courage, compassion, and determination. From her early days as a midwife in Jamaica to her heroic work as a nurse during the Crimean War, she left an indelible mark on the world. Her contributions to nursing and public health were groundbreaking, and she fearlessly advocated for social justice and racial equality. Mary Seacole's legacy continues to inspire nurses and healthcare professionals today. Her unwavering commitment to improving the lives of others serves as a reminder of the profound impact one person can make in the world. If you want to learn about more amazing Black nurses who have shaped history, don't forget to subscribe to this channel. Leave a comment below. We'll notify you as soon as the next video is released. Thanks for watching.